Hi, it's Henry Shelford from ADHD UK, here for the third in our series on myths around ADHD with Dr Shyamal Mashru. Brilliant to have you here again. Hello, Shai.
Thanks, Henry. Thanks for having me. I think this is part three of clearly a lot of myths about ADHD to get through.
I mean, there really are, and as you and I both know, we've got a lot to go through because we think 3 videos is a lot, but this might be a trilogy that turns
Yeah,
into
we'll
more.
wrap
So,
up the myths on this one, I think.
our main goal is to do it well. Just before we start, do you want to introduce yourself? Tell people about your clinic.
Yeah. So my name is Dr. Mashru. I'm a consultant psychiatrist and have been one for a number of years now. I work in the NHS in an ADHD service as well as in my private clinic. So my clinic is called the ADHD Health Clinic. Um, we've had some exciting developments in the clinic. So we see currently adults for ADHD diagnosis and treatment, and we are expanding the clinic now. So I have other consultant psychiatrists that I'm bringing into the clinic, or they're already there, started now actually. Um, these are consultant psychiatrists that I have personally worked with, so I know them very well, and I've kind of handpicked them according to their different subspecialty niches that they have. So I have a consultant psychiatrist, for example, that also specializes in autism as well as ADHD. I have another consultant psychiatrist that specializes in trauma, PTSD, as well as ADHD. And I have another consultant psychiatrist that is a more general psychiatrist that, for many years has treated patients for mood disorders, personality disorders, bipolar disorder, as well as ADHD. And the reason why I brought in these other consultant psychiatrists is because, you know, without downplaying myself, no one can be an absolute expert in every single thing. And by having a team, we can match clients appropriately to what kind of particular expert that they should see. So these are all consultant psychiatrists with a lot of years of experience. And we are also now from next month going to be doing adult autism assessments as well. And I think that's really critical. I've even had some messages on LinkedIn with feedback around this, and they've been right. There's a good proportion of patients with comorbid, we say comorbid, I don't mean that in a negative way, that's a medical term, but coexisting autism and ADHD. So I think it's only right that we provide autism assessments, and over time we will also be providing um, sort of psychotherapy and psychological therapies, particularly for autism. So yeah, some exciting developments in the clinic. Look us up. We are on www.adhdhealthclinic.co.uk, and we're providing both online as well as in-person assessments.
Great. Well, thank you, and thank you. Donate your time to this. It's and to do this, to share your knowledge, and so thank you for doing that.
Thanks for having me.
Right. Let's get into some myths, and we've got a pre-agreed list here. I'm already going to jump and do it in the wrong order. ADHD is not a serious condition.
It's not a serious condition, right? So, well, we actually had an interesting talk around this one, around a big study that was published not long ago around life expectancy in ADHD, and how there's
Yeah.
so that I mean, I won't go into the whole detail, but basically that was a very big study. They looked at millions of GP records, um, and the overall summary of this was that there is a reduced life expectancy in patients who have ADHD compared to patients who don't have ADHD, with all other factors corrected for. What that means is, corrected for matching up. So, for example, if I am the control patient, meaning the non-ADHD patient, you would match me with an ADHD patient who is my age, my ethnicity, my gender. We drink the same amount, we smoke the same amount, we have similar physical health condition. So basically ruling out all other co-founding factors that might influence someone's life expectancy. ADHD alone brings your life expectancy down if it's left untreated.
And the figures are brutal, right? So I think it's a reduction in lifespan by 9 years for women versus their peers, and 7 years for men versus their peers.
And not just life
We,
expectancy, though. Sorry to cut in there, but not just life. I mean, life expectancy is big enough, but also, there have been other studies about quality of life, right? It's
yeah,
not living less years, it's about the quality of life if you leave this untreated. The impacts on education, employment, the socioeconomic impact, eh, on a massive scale. Like, there have been big studies done in the US. We're talking there's absolutely no doubt of the impact on education, employment, road traffic accidents, use of substances and alcohol as coping mechanisms, and then that can lead into addictions. I'm not talking about all ADHD patients here. This is not a judgment statement. This is just data, yeah,
yeah.
from big scale data. So,
And it is a
um,
big scale, right? I think it was 8 or 9 million GP records that were analysed. So this is it is very significant. Yeah, it's 4 times the rate of anxiety. This is for men, 5 times on depression, 2 times the rate of self-harm and suicide, 20 times more likely to smoke, 3.5 times more likely to drink alcohol, and it's similar numbers for women. Just,
yeah,
yeah, the stats right in front of me. Um, that's not all. Obviously, you've got the statistics on suicide too, right? Like, so,
yes, yeah, you have a
where it's one in 4 women with ADHD will at some point try and take their own life. 1 in 10 men. For women, that's 7 times the baseline, and for women, 4 times the baseline. Uh, and it's always one of those things where people ask, like, what's more damaging, the label or the condition? You're like, I mean, it's very clearly the condition. I don't like it. But the fact that people consider the label to be so damaging is really a recognition of the stigma that we have to deal with. That's even a consideration.
absolutely. And yeah, I think it's akin to other chronic physical health conditions. It's like saying diabetes is not a serious condition. Right, well, but yeah, but if you leave your diabetes untreated, you're gonna have lots of other problems. Similarly, in that
It's a
way,
good metaphor.
if you leave this untreated, it's gonna really cause some harm to you.
Yeah, and obviously we're dealing with very long waiting lists right now, and that's one of the big pushes we're trying to focus the government's attention on. No pun intended. Right, on to the next myth. Is there a single test for ADHD?
So, in summary, there are clear national guidance, nice guidance around what should be included in an ADHD assessment. And the summary of that is that it should be a holistic assessment, right? Not only looking at ADHD symptoms, of course, that is a big part of it, but also looking at someone's general mental health symptoms. So if I was a patient, then the first thing that I would want is, or I would recommend as to patients, is find an expert that has not just ADHD knowledge, but also good experience and knowledge of recognizing and treating other mental health conditions as well. We know that ADHD is in what we call a highly coexisting condition. 70 to 80% of people with untreated ADHD have cycles of depression, anxiety. Some people have been diagnosed with things like bipolar disorder, or personality disorders. There might be histories of substance misuse, alcohol misuse, etc. So I can speak for how we do this in our clinic. There are different clinics doing this in different ways. But when I've set up my clinic, I have worked and chosen consultant psychiatrists that have different subspecialities, which we make quite clear on the website. So one of them is a general psychiatrist that has many years of also treating depression, anxiety, mood disorders, bipolar disorders, personality disorders, as well as ADHD. Another one has a lot of experience of autism as well as ADHD because the conditions are highly coexisting. And another person has a lot of experience of trauma patients and PTSD as well as ADHD. So I think you want to find the person that looks at you in a holistic way and has expertise of looking at those things. So that when you come to your assessment, it should not feel like they're just going through only ADHD symptoms, but also assessing your general mental state. I think that's really important as part of the assessment. Um, and also as part of the assessment, you should be given some pre-assessment forms, which are also part of the assessment. So those pre-assessment forms, I mean, I can say what we do in our clinic. So for example, we will ask about childhood history. We will ask about adulthood history, ideally from informants, meaning from people that might know you well, if that's possible. If it's not possible, we'll send you a different kind of form for you to do. But we'll also ask about ADHD symptom frequency, which is commonly used, an ASRS screening tool, about depression and anxiety symptoms, because that's seen so much in ADHD, and also about autism traits as well. I think that's quite important part of the ADHD assessment too, actually. So it should be very comprehensive.
When we were talking earlier, you talked about the approach being like someone's come to you often with a very clear idea that they think it's ADHD for them, and your approach is to go, well, let's learn about them, understand them, and maybe the answer is ADHD, but maybe it's not.
Yeah, or maybe it's ADHD plus X, Y, or Z, right? And maybe those things need to be treated differently. Um,
And I think the idea of like someone's coming to you, they're not worried, they're almost certainly there because they're in trouble, they're struggling,
they want help.
and trying to understand, and want help, and understanding what those reasons are, which is as someone with that wide experience, you can do very well. Um, the problem of there not being one test, back to the myth, is that a whole load of people go, well, if you can't like test it with your blood or a brain scan, then it's not real. What do you say to those people?
um, well, most mental health sort of symptoms cannot be seen, unfortunately, by, well, it's that part of just that part of the brain, and that tells you whether it's there or not there. It's so much of this in generally in mental health is based on a good history, a longitudinal history of someone's lifespan, right? Um, it very much is there though. I don't know how most mental health conditions. Let's just take schizophrenia as an example. You see a schizophrenic patient, you can very clearly see they're responding to voices. That things are going on for them. And yet, yes, there are certain features you'll see in the frontal cortex of the brain, but there's no what we call pathognomonic sign where, oh, that's there. I can see it on the scan, and that's schizophrenia. And yet, but when you look at even without being a psychiatrist, you would say, oh, okay, there's something going on there for that person. Um, it's certainly lived experience. The person will describe it. Um, and I think that's why also the informant reports are quite important, actually, because it, you know, it should be at least the close people around you would be able to see this, right? Your partner that's been living with you, right, for
Yeah.
example, will will experience the other end of it, right? So, they'll tell you that and I think that's where the informant reports. I do appreciate, we do get some clients that say, look, I actually don't have anyone around. And that's, we would still see those clients because actually sometimes those might be the most troubled clients. They've actually severed their relationships.
I remember meeting someone who's diagnosed, I think they were 76, something like that. And they were asked for reports to be filled in by their parents, for their school reports, and ideally, like I think a teacher report. And um, apparently, they just looked them in the eye and went, "They're all dead. My parents are dead. Teachers are dead.
I mean,
70 something. I don't have my school reports. What are you
jovial. I feel
talking about?"
I don't mean to be jovial about this. Obviously, it's not a jovial matter, but you also have to be realistic. There's interestingly also a cultural aspect to this, Henry. Right? So I'm personally from a Asian background, right? Um, I've had patients come to me from different cultural backgrounds who will tell me, listen, my parents don't even believe in any mental health stuff, right? They just thought I was lazy.
Yeah.
And then you give the informant report and the parents will just tick no, 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 no. But the patient you're seeing in front of you is a dictionary description of what's going on in ADHD, right? Plus or minus other things as well, right?
Yeah.
Yeah. So you have to also, I think, bear that in mind, that the cultural context of people. Um,
And what about the sort of parents in denial, where like there's clearly they have ADHD as well, but they're
yeah, yeah, yeah. So
doing all
they'll
right with it. So they're just like, this is normal. Like there's nothing. My
no,
kids
no,
is normal.
often say no. I was much worse. They'll say I was much worse than my child. They're doing really well. Um, I think that's all part of psychoeducation, really, isn't it? So much of major causes, obviously, it runs in families, right?
Sure. Yeah. A large
Uh,
genetic component.
so, yeah,
Um, the moving on with myths, we've got a mission to complete.
yeah,
Much we love a sidebar. Um, ADHD is just a lack of focus.
no.
There are no
um,
clues in the name. I didn't know this.
Actually, and I think I've mentioned this before. So first of all, let's talk about the focus element and the name of this, um, if you want to call it condition, whatever you want to call it, but attention deficit. It's not actually a deficit of attention. That's actually not what this is. It's a dysregulation of attention.
Okay, interesting. I use the phrase it's not a deficit of attention, it's a lack of control of attention.
That's another way of putting it. Whichever way, but it's meaning the same thing. It's you
Right.
lose the you
Okay.
lose the control for attention, right? So so if we look at the TV and the remote control, I think I've probably done this analogy before, so apologies for anyone who's seen it, but at some points the TV volume is full blast, just comes on by itself. Other points it goes to completely on mute, and other points the other TV in the other room turns on at the same time. The channels keep switching, and there's the remote control goes, right? And there's another element to attention, which you might say happens to everyone to some extent, but it happens to patients with ADHD in a lot more um, uh, intensity, is attention is emotionally linked,
Okay, yeah. Okay.
right? So I'm interested in something, I'm passionate about something, I can really focus on it. And then the negative way, I was negatively impacted by that statement, or I felt this person made me feel this way, and then that's just burned in their memory forever.
Yeah. That
It's a
sounds
very
achingly
emotional.
familiar. The analogy made someone raised that analogy with me just in the last few days, but they were talking around emotional regulation, emotional dysregulation, which you just talked about, attention being emotionally linked, and the analogy it was to teach people to help them manage their emotions, and the metaphor was it's like a TV, the channel's switching, but you can control the volume, and controlling the volume is controlling your emotions, your emotional reaction. And your analogy just then was like the TV switching, the volume switching. Um,
Depends on how.
like let's push the metaphor. What would be your metaphor for the emotional like regulation, dysregulation issues of ADHD, and how to manage them?
So the analogy of the volume is that the emotional response of the volume goes very high, right?
Yeah. But in that analogy, the one given to me was that you work on, well, you can control the volume in the way you respond.
So, and then interestingly, for some patients, that can also die down very fast, actually, and for some patients, it can linger, right? Now, a lot of this is, we've spoken about this one before as well, but the pause goes in ADHD, right? So that thought of rationalization almost at that time, meaning does what's happened require this level of response? Can you rationalize it? that's the bit that goes. And a lot of the time in things like coaching, those are the areas that are worked on, about being able to almost take yourself out of that moment and observe yourself for a minute. This is also taught in mindfulness as well. Medication can help that to an extent, but I think this is more in the realms of non-medical strategies.
Yeah, it's such an important area, particularly for people who are struggling with emotional regulation. It can be absolutely disastrous for life, like career ruining, life ruining, and becomes points of real import. Right. Um, uh, Next myth: medication cures ADHD.
Hmm. Um, Unfortunately,
I wish it
medication,
was like the film Limitless. God damn it.
it doesn't cure it. Unfortunately, this is not a chest infection. You take 7 days of antibiotics and it's gone. Unfortunately, it doesn't cure it. And actually, patients will tell you, some patients can actually delineate exactly when their meds are wearing off as well, over time. Some people can't. Um, and this is where, again, we talk about coaching strategies and just life skills, right? And trying to learn ways to help manage yourself as well alongside meds. Um, but unfortunately, no, medication will not just cure it.
I think the phrase I like to use is it's a helping hand. Like, and
However, however, I will caveat this. I think I mentioned this before. There has been some studies done in the US on children, young children with ADHD. We're talking 6, 7 years of age, where they are looking at if you actually medicate more aggressively in children, which has traditionally been the opposite approach used in the UK, where you're almost like, well, we don't want to medicate children, right? Understandably, right? What they're starting to see, maybe, and I think there's still more work in this area, is actually if you do medicate them while the brain is developing, they may not should be showing symptoms or signs of a ADHD, like a disorder, in adulthood.
yeah, this is obviously the edge of science, and this idea which, to answering that question, medication, to the myth medication cures ADHD, the answer in part is it might for younger people, and we're just learning about that and whether or not that's truth or not, but there's some indications. um Talking of medication, and are you just a shill for big pharma?
So, well, again, I'm going to talk about my clinic for a moment here. We don't just do medication; we do coaching as well. And I often actually will come across. Look, the nice guidance will say the first line of treatment for ADHD is meds, and the reason why it says that is because medication can be extremely effective, right? If you get onto the right medication for you. But I believe in treating people individually, what we call patient-centered care, which means treat the person that's in front of you and take on board what their opinions and expectations are. My colleagues as well that work in the clinic, we don't always just jump to medication straight away. Some patients we might say, well, really, you know what, actually, I think you might benefit really well for some medication. The best treatment approach is to do medication as well as some ADHD coaching, some psychology work, etc. And some patients will come to you and say, "Well, actually, you know what? I don't take any other meds. I don't want to go on any other medication, and I'm quite motivated to try non-medical approaches." And we'll guide that person down that route as well, particularly if they're what we call psychologically minded, if they're motivated um, in helping themselves. Those are the kind of clients that will actually do really well with the non-medical approaches too.
But there's a difference, isn't there, between motivation, like the desire to do it, and the ability to do it.
No, no,
How do you bridge that?
no. So, for example, if I have a client who tells me, um, "Yeah, I don't really believe in any of that mumbo jumbo and this coaching and this talking therapist stuff, etc." I'm not going to necessarily put that person down that route because they already have a psychological block to do that. And sometimes what I then find is they'll take medication, they improve in their symptoms, and then they start to research more about ADHD. And then they'll actually say, do you know what? Actually, I can actually now start to see more clearly that whilst medication helps with X, Y, and Z, I still now want to work on this. And then they might become more open to other types of non-medical approaches alongside their meds.
That's certainly something I've seen in myself and like in others, that medication as a helping hand actually helps you be able to stay focused long enough to think about your issues and start to create solutions for them and see through some walls that were there before, and that being quite a big deal. But look, now imagine we're at like a lovely party, but a bit oafish. Um, Someone wanders up to you and you say what you do and your specialism, and they go, "Oh, it's just a complete myth. Like it's just big pharma flogging drugs." Like you're, I don't know if you drink. Do you drink?
That's right. Yeah.
Okay, so you're 2 drinks down. What do you say?
If I was 4 drinks down, I might give a different answer. If
Okay,
2 drinks,
I want both answers. Sorry. Okay, what's your
no.
2 drinks down?
Well, look, what I would say is, well, I might not even entertain that conversation in real life, but what I would say for the purpose of this is, actually, this is what I would say. So, first of all, what I've already said about the real data showing how much impact this has on people's lives. But number two, what I will say is, and this is what I tell a lot of when I give talks to GPs. So I tell a lot of GPs because obviously there is a lot of stigma out there about ADHD right now. Your patients, once they're treated in whatever way, medication, coaching, etc., do they report feeling better? Because so many of them do. And these are people who are always going into the GP saying this antidepressant doesn't work, this thing in my life is not happening correctly, etc., 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 etc. So if the treatment works, then there must have been something there to be treated. Does that make sense?
It does. Yeah, it does. 4 drinks down.
Let's not go into that.
Let's not go there. Um, uh, the Some people do put forward that doctors are pushing medication for financial gain. How do you deal with that?
Well, what I would say again is looking at data and my own experience. Um, there's a reason why the NICE guidance has put it down as first line of treatment, which they have, which is actually the opposite. Like if you that's not the case for all different types of conditions where they would recommend meds first, right? For really low level depression, anxiety, that actually say try CBT first. Um, so the fact that they're putting meds down as first line, the data shows that they can be extremely effective. And my own personal experience, as well as my colleagues, they can be extremely effective in improving not just executive function, but also the emotional elements of ADHD as well. And then if you combine that with non-medical approaches, the effectiveness just enhances even further.
Yeah. And frankly, like that entire sort of attitude is based in the stigma against ADHD, or actually against mental health wider. Like you're not having any discussions around, let's say, I don't know, insulin, like
No,
where it's a physical condition. People like, and although now I'm thinking about vaccine discussions, and where that's gone,
not go there, but yeah.
there's some swings and roundabouts. Um, we've already covered this myth on medication is the only treatment for ADHD. I think you've covered that off. ADHD. I had a wonderful conversation with someone, media person, and they're like, "Well, is it just in your head?" Like, and I looked back and went, "Yes."
Yeah.
You idiot. um, is ADHD just an excuse for laziness? Like, am I just lazy? Is that my core problem?
Um, so sometimes often people misinterpret the lack of motivation as laziness. Actually, so there's a symptom called procrastination, which I don't think is explained well enough in this field. When you really get into the nitty-gritty of procrastination, there's two things that are going on. Number one, often people with ADHD will actually describe feeling so overwhelmed with a complex or mundane task that they just don't even know where to start. That's not the same as being lazy and I just can't be bothered to do it. It almost cripples them with so much anxiety. As a natural human reaction, you'll say, I won't do that now. I've still got time. I don't want to worry about that now. Secondly, if we look at the chemistry of what's going on in ADHD, there's a lack of dopamine and a lack of noradrenaline. Noradrenaline breaks down in your system, in your brain and nervous system, to become adrenaline. That happens during fight, fright, or flight situations. So people with ADHD chemically need that threat of a hard deadline or some form of accountability to put them into that state of perceived threat for the noradrenaline activity and the nervous system to activate. So it can look like, well, that person's just leaving things to the last minute or just constantly asking for the deadlines to be pushed, et cetera, et cetera, et cetera. But it's causing them an internal sense of overwhelm. And if they were just simply lazy about this, it wouldn't bother them in that way.
You mentioned motivation. You said a lack of motivation. What do you mean by that?
So in some patients where we see a mood component to their ADHD, there might be a depressive component to it. And it also feeds deeper into self-esteem, where over time, people just feel, I just can't do this. I'm not good enough. Maybe I am a bit dumb. These kind of internal negative messages, eventually, if you just think of it more, forget it as symptoms, just think of it from a human perspective. Where's the desire then to do it? And that's where the fear of failure and rejection sensitive dysphoria and all these things come from. If you have all those fears and you feel that way about yourself, why would you be then motivated to get X, Y, or Z done? And then over time, it can even lead to depression symptoms, true depression symptoms, people not getting out of bed. They don't even motivate themselves to look after themselves. Obviously, in this line of work, I see all different extremes of this. So that's where, all these terms, procrastination, lack of motivation, rejection, to me, they're all terms, right? But what's going on? Like, how did that person get to that state of mind? It's quite logical, isn't it?
Yeah.
If you look.
Um, we're on to our last myth.
All
We've
right.
completed this series.
Well
You can't have ADHD if you do well in school or work.
done. So this is an interesting one, actually, because traditionally, diagnostic guidelines have focused on, you know, really disruptive children and labeled them as having, well, we used to be hyperactivity disorder, but then became ADHD. Many patients who, let's say you came from a background with maybe high parental expectations, you will have forced yourself to get by. You will have always felt that you are working harder than your colleagues, to the extent of maybe costing you your social life, for example. You go to work, you are the one that's doing all the hours after hours because that's when the office is quieter. So from the outset, it can look like, well, but they're getting all their things done. But then when you delve into that deeper, it's having negative impacts in other areas of their life. It's coming at a cost. So now they don't have as much time for their partner. They're getting into more arguments with partners. They're getting more stressed. This is where overwhelm comes in. right? This isn't overwhelm is just another outward description of an outward um, feeling. But what's going on underneath that? How did you get overwhelmed? It's because you are putting so much in to getting the basic things done. There's just there's no fuel left in the engine to do anything else more. And then it's called burnout. That's the process of this.
The phrase I'd heard a long time ago was, "I have ADHD. I can do anything. It just costs me everything else."
Yeah.
Which you were talking to in that like in that point of how much more it costs people.
Yeah. And yeah.
Yeah, and so I think the idea of, like, you can have success, but yeah, it's the difference price paid. Um, and it's also why you see lots of people. You see certain people falling over, I think, at certain points, and particularly points of change. So where they've had structure and it's been okay, and then that isn't there, and so they get to a sort of essentially a ceiling. I see people, might be GCSEs to A levels, might be A levels to university, or first job,
I'll tell you.
or a promotion, or changing company. Kids, particularly, and
Or so a couple of big ones that I see is when they go from the structured home environment to university somewhere else, living
yeah,
alone. That is they people find it really hard to develop their own structures, to be able to look after themselves. Um,
yeah,
and
yeah,
then also women, you see the hormonal changes in the early years, but then particularly when you go towards perimenopause, menopause, because those exacerbate the ADHD symptoms and the emotional dysregulation so much. At that point, they might come and say, "Listen, I'm not coping anymore."
yeah. Um, yeah, which obviously we see a lot as charity people coming forward. Why, when children arrive, we see that having a significant impact is because, as you talked about, people working late, like, the number one coping mechanism is to throw more hours at the problem, and suddenly children arrive, and you just can't do that in the same way,
No.
and as well as all those increased demands on your time. We're done for myths. Close the series, 3 videos. There'll be more. Thank you as ever. Do you want to quickly just tell people again about your clinic and what you do? Like this.
Sure. Thanks. So Henry, so my name's Dr. Mashru. I'm a consultant psychiatrist. Um, I have been a kind of medical lead of NHS ADHD services as well as my own private clinic, which is the ADHD Health Clinic. We're expanding the clinic, so we offer both online and in-person ADHD assessment and treatment in the form of medication, as well as having ADHD coaches. We have other consultant psychiatrists who I've worked with personally, working in the clinic, who have other specialities. So we have a consultant psychiatrist that has a speciality as well as ADHD, but also autism. Another one who has a speciality in ADHD as well as substance misuse. We have another consultant psychiatrist who has a speciality in ADHD and trauma, and we have a final psychiatrist who has a general psychiatrist, has expertise in ADHD as well as other mood disorders, bipolar disorder, and personality disorder. So we try and match you with the right patient. And from next month, we will also be having adult autism assessments as well as psychological therapies for autism as well, because autism is highly comorbid with ADHD, as we know.
You donate your time to do these, for which we're very grateful. I'm very grateful, and obviously people learn a lot from that. So, and gosh, some people might like decide they like you and rate you, and therefore want to see you. So we also want people to be able to find your clinic, and it's a way to say thank
Or
you,
one
to
of my
let you talk about it.
one of my
Um,
associates. Yeah.
yeah, or your associates. Now, obviously, we have you on because we rate you very highly, and are grateful for the time. Thank you very much. And yeah, I need to say goodbye. So thank you, Sean, Dr. Mashru. Thank you. And that's for me to sign off. With Charity ADHD UK, we get no funds from government. It's entirely personal donations. Uh, it is hard every month. We're not a huge charity. We struggle financially. Those donations, fundraising, it matters. Thank you all those that have done it. Do consider donating or fundraising. We can do nothing without you. So thank you. And thank you for tuning into this. Thank you.